Well, the pandemic has had a tremendous impact on the quality of life for so many people. It's canceled surgeries, doctor's appointments, and checkups. Thanks for joining us for Fox 4 News at 10. I'm Jane Monreal. Patrick has the night off. Tonight, Fox 4's Rochelle Aline shows us the impact it's had on the chronic pain community and why they say the problem is bigger than the pandemic itself. Rochelle?
The woman in tonight's story tells me she wanted to remain anonymous because she's afraid of pushback, and she's also afraid she could lose access to one of the many things that provides her with some quality of life.
Just hold on. Hold on.
A tearful plea to other chronic pain patients.
I'm hearing and seeing of suicides every day.
From a woman who's no stranger to daily pain after a rollover crash 20 years ago.
I actually have the spine of about a 90-year-old. My pain is constant.
It's pain, she said, that's been made worse for thousands during the pandemic because doctors' offices were closed and access to pain medication was scarce for some patients.
Just getting in touch with them, setting up the virtual visits, which they finally, but yeah, I mean, it was difficult.
But the issue with access to pain medication is one that she and many other pain patients tell Fox 4 started way before the pandemic.
We're fighting to have a voice. We're fighting to be heard.
They say it links back to CDC guidelines pushed out in 2016 in an effort to curb opioid overdoses. But those with chronic pain say it's made it difficult to find doctors who will prescribe their meds and to get a pharmacy to fill the prescription.
It was never meant for chronic pain patients.
The American Medical Association, or AMA, has recently called for the guidelines to be reversed, and the CDC has created a task force to look into it.
There is a lot of confusion over whether prescribing really is the problem.
Chronic pain advocate Richard Lawhern says the community is fighting to get those guidelines pushed back too, and says this is one of the best ways to get it done.
You can call your legislator.
But in the meantime, that woman says, medication or not, she's left asking herself this question every single day.
What is an acceptable amount of pain that I can function with?
And you can head to fox4now.com for links to all the information we discussed tonight, including the full AMA statement. In Cape Coral, Rochelle Aline, Fox 4.
Thanks, Rochelle. And if you or anyone you know are battling with suicidal thoughts, do not hesitate to call the number that is on your screen right now. This is the Suicide Prevention Hotline. It is free and someone will be available always 24/7.